Untouched by human hands, it's the Medicare for the Lazy Man podcast. A podcast still searching for the real killer. He once tried to unscramble an egg. Medicare expert Doug Jones.
Hello, everybody. Welcome to another thrill-packed episode of the Medicare for the Lazy Man podcast. I am your Medicare specialist, Doug Jones. I'll be here all week, so let's be sure and tip your waitress, shall we? I am here to help you feel confident that Medicare is going to be an excellent improvement in your medical insurance protection, only when you are able to join Medicare. Not everybody gets to be in Medicare, and not everybody gets to participate in Medicare until they actually take the steps necessary to enroll in Medicare. And that's what I'm here for, to help people with that transitional period from your Obamacare coverage to your Medicare coverage. I want to make it seamless and painless, and I especially want it to be flawless. Your entry into the Medicare world could be done in a way that doesn't leave you many options for freedom of choice in the future. And I want to help you avoid that eventuality by enrolling in Medicare in such a way that you retain your freedoms and that they're never in jeopardy of being taken away from you. Well, how do I do all that? One way I do it is by asking people to read my book, Medicare for the Lazy Man. And if you go to Amazon.com and type into the search window, Medicare for the Lazy Man, be sure and add 2026, because that is the current edition that's for sale on Amazon. It will give you all the information that you need about Medicare and none of the information that you don't need. Although I will say people are pretty creative about coming up with questions that I hadn't thought to answer. But the interesting thing about Medicare is you don't really need to know a whole lot about it. So you might wind up with a book like mine that's less than 100 pages long that tells most of the things about Medicare, but many of the things about Medicare that you'll find in my book are interesting reading, but they're not essential for you to make the most of your Medicare experience. What I do is I put the important stuff in the first few pages so that when you start reading the book, you're going to find that the first chapter instructs you as to your Medicare selections, the availability of those selections, and the choices you want to make to preserve the freedoms that you have been offered under the Medicare program. And after that, anything else is icing on the cake. So, Medicare for the Lazy Man 2026, that's going to be an $11 paperback purchase. It's going to be a $5 purchase if you have one of the readers that Amazon supports. And it's going to be about a $6.50 purchase if you want to have someone else read the book to you. It's almost hypnotic to listen to the dulcet tones of the professional who actually reads that book under the Audible label. And then finally, if you want to purchase a copy of the book that you can then proudly display for your friends and neighbors for the rest of your days and have them ooh and ah and be highly impressed with your taste in literature, that would be a $25 item purchase for the hardcover version of Medicare for the Lazy Man. But it is such a magnificent creation that Amazon and I have collaborated to present to you that $25 is going to seem like a drop in the bucket. You may pass it down to future generations, or you may donate it to institutions of higher learning that need some Medicare knowledge. I have to believe that a lot of those institutions just don't have a lot of Medicare information available to them, and you would be doing a favor to some institution of higher learning to share that knowledge with them once you've finished with the book, once you've made the decisions and taken the actions that the book will teach you how to do. Now, you may also need to learn how to use the government website to select your own drug plan. And I've written a book to help you do just that. It's called Medicare Drug Plans, a simple DIY guide. And it will teach you how to enter the government website. The URL is medicare.gov/plan-compare. And as you go farther and farther in that process, it could become more and more confusing. So my book is designed to take you by the hand and lead you through the plan selection process so that you don't make any mistakes and you come up with the best drug plan for you. And the best drug plan for you is always going to be the cheapest drug plan that covers all of your drugs at the pharmacies that you want to participate with. You want to purchase your prescription or fill your prescriptions at those pharmacies. And so there is a definite hierarchy in most companies of drugstores that are offering sweetheart deals because they're in network or they're preferred by certain drug plans. Well, all that gets very complicated, and that's what the government website is designed to help you figure out. But it's not as simple for everyone as it looks. Now, the nice thing about this book is it will be useful for you every fall as what is often called open enrollment, and I call it AEP, annual election period, comes around. From October 15th to December 7th, you have the opportunity to replace the drug plan you bought last year if it's not going to be advisable for you to continue it into the following year. So anytime after October 15th, you're able to put that same information into the government website and find out whether it will be the best plan available for you the following year. If so, you can just hang on to it, not do a thing. It will automatically renew. If not, what you do is you follow the enrollment portion of my book. You will enroll in the plan that will turn out to be the best one for you in the following year. And then that will supersede your original plan. Your original plan will be canceled on December 31st, and your new plan will go into effect on January 1st, and you'll be good to go for another year. So this book is a year after year after year tool that will assist you in maintaining a disappointmentless experience with your Medicare drug plans. Finally, you want to know how to enroll in Medicare, and you don't need to know anything else, and you don't care about anything else. Well, I've got the book for you. It's called Medicare Enrollment Guide. It's available on Amazon. I think it's a $5 purchase for the paperback book. It's a $3 Kindle purchase, and it will be free for you if instead of going to Amazon, you go to my website, medicareforthelazyman.com, and just scroll down a little ways, you're going to see a link to Medicare Enrollment Guide. That will be yours. You just click on that link, and the book will be in your phone. It will be printable. It will be savable, and it will not cost you a thing. And you don't even have to tell me what your email address is. I'm not going to force you to join my mailing list in order to get that book. I want everyone to have it without any encumbrance whatsoever. Medicare Enrollment Guide. It will teach you the steps needed to enroll in Medicare with a Medicare supplement and a Medicare drug plan. And it will be, it is such a short, powerful book that your use of that book will be over before you know it. And you'll be happy that you got it free of charge. So with that having been said, let me turn my attention to Randy Carson, who is sitting out in Arizona, and I understand in fantastic, magnificent weather. It's just not summertime at all, I would guess.
I would describe this as paradise.
That's a magnificent thing to hear. I wish I were there to help you enjoy it.
It's still only 87 degrees.
My God.
And I'm telling you, tomorrow is we're not supposed to tell anybody, but tomorrow is the 1st of July. But
Yeah.
uh,
So,
my bottom line is usually you could go out in the backyard and fry eggs on your forehead, but 80, well, okay, I lied. 87 degrees.
no, that's
And
what you said.
it's just gorgeous. What's
Yeah, it
going
sounds
on
like it.
here, Doug? Am I dreaming?
The world might be coming to an end, but 87 degrees at noon on a summer day is highly unheard of. And frankly, I would expect that the sky would be all cloudy and you'd be looking at
No,
a rainstorm coming in, one of the
no.
monsoon storms.
There's not a cloud in the sky, and I'm telling you, it's gorgeous.
Well, then enjoy it. Don't look a gift horse in the mouth. Just enjoy it.
So what are
Yeah.
you doing out there in the low ground?
Well, here in Illinois, it's basically just trying to stay out of Pugsley's hair. If you draw the attention of Pugsley, then you're likely to have your favorite hobby outlawed, or any number of bad things can happen. So I'm just trying to avoid Pugsley to the best of my ability.
Well, I've unfortunately I've heard that there's a few long-term companies that have been around for about 4,000 years are leaving Illinois. They claim because of Pugsley.
Well, that's an old story. We've seen it happen in California. We've seen it happen in New York, and frankly, some of those states are going to continue to suffer that sort of exodus of jobs and economic activity. So I was invited to join a society. I'm thinking about it. I don't know what the ramifications are, but I got this really nice envelope, and I opened it up because I thought it looked like an invitation to the school dance. Only it was all
Oh, really?
yeah, and I thought, oh boy, who's asking me to a dance? And it's a society. They want me to join a society. So I'm thinking to myself, well, this is a society. If they're going to invite me, they'd probably invite everybody. There's unlikely to be very, very exclusive. Dear Douglas, for over 50 years, the Neptune Society and its affiliates, and I'm a swimmer.
Oh,
I like to swim.
Oh, well, that's got nothing to do with Neptune, I'm telling you.
Oh, really? It's not a swimming society? Like
No,
a
it's
swim
not
club?
not a swimming club, not the one
Boy.
I'm aware of.
It's been recognized as the largest and most trusted cremation. I don't know what this cremation. Oh, could it be cremation?
Yes, yes. Neptune, to my knowledge, they put you in a little brass box, and you get buried at sea.
Oh, wow. Well, here's the deal. They provide simple cremation at an affordable price. Now, I think I remember, if I recall correctly, Adam Carolla's family got hauled out of their houses one by one and never to be seen again. No funeral service, no burial, and they just, I guess, were turned into ashes and thrown in the ocean.
Okay.
And in fact, he said his grandmother was picked up by a guy in an old rusty station wagon.
Oh, jeez. So, that no, they do better than that? Oh, come on.
Apparently not. I don't know what they're asking for the an initiation fee. I just threw it away. I'm not going to join the Neptune Society if it doesn't have anything to do with swimming.
Well, by the time you get to be a full-fledged member of the Neptune Society, you will not care about swimming.
Well, darn it. That was the only reason I was interested at all. So that's the end of the Neptune Society's relationship with me, that's for sure. Well, I'm out of interesting information.
I suppose we ought to try to make some money today. What do you think?
I do have a thing that we'll discuss later on. It kind of restores my faith in WalletHub. I hadn't run across a WalletHub quiz that we used to do regularly in a long time. And so I went out looking. I Googled WalletHub and I said, show me what WalletHub has been up to lately. And it provided one of these WalletHub lists that we've seen before, but it restores my faith in WalletHub. Maybe they're not the out of control commie lefties that I was always afraid they were.
Well, our audience will be the judge of that.
Yes, they will. And frankly, I don't mind sharing this with them after our Medicare content has been dealt with.
So do you want to make some money today?
Yeah, I'd love to. What are we going to do differently than we have been doing all this?
I, I, I have a number of ideas, but so far they haven't come to total fruition
Well,
yet.
I hope podcasting isn't on the list because that is not a way to make any money as far as I'm concerned. In any
Well,
event, it is a
it's
way to
like
satisfy the audience, though.
it's like the old joke. They asked a farmer that won the lottery back in Iowa. I think it was 12 million, and they said, "What are you going to do with all that money?" "I'm going to farm until it's gone."
Yep, and I've often used that story to launch into what happens when you like to restore cars. So how do you make a fortune, a large fortune, restoring old cars? Well, you start out. No, how do you make a small fortune? And you start out with a large fortune and
Yep,
just keep doing it. And
absolutely.
eventually, your money is gone. Well,
Same thing with farming.
yeah, apparently so. I will say though that I did some research, and I was told that what was I told? I was told that bacon. We've discussed bacon before.
Yes.
I never asked Claude why I hate bacon, and I never used to like. I never used to hate bacon. It used to be my favorite food. It was always just the most coveted meal we would have on a weekend would be bacon and eggs or bacon and waffles or something. And I said, why, Claude, why is it that I hate bacon now? Am I crazy or is it bacon's fault? And Claude confirmed for me that it was bacon's fault, just as you have confirmed in the past that the hogs are not the same. Some kind of trendy crapola has taken over the methods or the marketing of pork, and
Yeah.
it's just not the kind of pork that we used to enjoy. And then Claude showed me two or three different sources of heritage pork that I might want to try. I'm afraid of trying them and being disappointed, but I may give them a try. One's in
Well,
Kentucky, and
you may if you can't really decide whether they're good. Well, it sounds good. Heritage bacon.
yeah,
I'd buy a truckload of that if it tasted good.
yeah. Well, that's what
So
I'm going to do. If it tastes good, I'll report back to you in the future.
then if you report back and you have this little sad face on, I go, nah, wasn't any good.
I mean, well, people said Newski's. Newski's is great. Newski's. And so I tried Newski's and I didn't like it. Now, I think they were adding apple flavor to disguise the crappy,
Oh, no, we don't want any
unhappy.
apple. No, we don't
No,
want any apple flavor in it. We just
yeah.
want bacon.
So I crossed Newski's off my list. And people probably turn up their nose at Oscar Mayer, but Oscar Mayer bacon cooked to perfection was the gold standard as far as I was concerned of
Yep.
bacon back
Yeah.
then. It
Oh,
was
I
very
know.
good.
I know. I get it. Now that you've got my mouth watering.
Yeah, I'm sorry I brought it up. What started me thinking about it was we're here in Illinois. We have the waffle iron that we were given at our wedding, which was some 55 or 53 years ago or whenever it was. And that waffle iron is still cooking fantastic waffles.
Well, let me tell you my waffle iron story.
Please
We
do.
have we have a waffle iron that we got when we were married, and the waffles right out of the get-go, obviously we didn't know what we were doing. We were just young and stupid when it came to waffle irons.
Hmm.
The waffle mixture welded itself to that waffle iron, and it's never worked since.
No kidding. Now they tell me, of course, our waffle iron has is lined with Teflon, but before that, when I grew up, we had a waffle iron that was just iron,
Yeah, yeah.
and they always said you had to season it with
Yeah.
oil, like vegetable
Yeah.
oil. Did you
Yeah,
ever?
well,
Is that the step you overlooked?
apparently, because I think this waffle mixture, I
Uh-huh.
think you could make cars out of it. It welded itself on there.
Oh boy.
It's really incredible.
Yeah, that's unfortunate. You missed out on excellent eating there.
I know. I would have had a lot more waffles. We kept trying it over the years,
Uh-huh.
going, okay, well, maybe it got better over time. Nope.
It does. Yeah, it doesn't fix itself just sitting on a shelf somewhere.
No, it doesn't.
It
It
has to be
doesn't.
attended to by somebody.
We need to take it to the waffle iron repair shop.
Well, you might need to replace it. I actually got one recently that was a Cuisinart, and it's a little round thing. It doesn't, it's not the big giant waffle maker of old, but I can't wait to try it because, I love good waffles, and this
Yeah.
is one of the few that is not a Belgian waffle maker. It's,
Oh, yeah.
I hate Belgian waffles, and this is an American waffle iron that we bought in Arizona right before we left. So I haven't had a chance to try it yet. But
Well,
if it's good, I'll let you know.
got to read the directions because otherwise it might weld itself together.
Well, I'm hoping not because it also has Teflon. I think maybe you need more Teflon in your life if you're going to enjoy waffles.
I think so. I think so.
Yeah.
Well, shall we make some money here?
Well, either we could do that or we could do some podcasting.
Well, yeah.
Jeez, Mr. Optimist here.
Someday we're going to make a dime out of this thing. So anyway, I'm going to go ahead and mute out. And
I'm going to start my 20-minute timer.
Cool.
And this is my promise.
You mean that one that needs a battery?
Well, it doesn't anymore. I got a new battery for it. Thank you very much. But it's my promise to the world not to bore them with Medicare content for any longer than necessary. So 20 minutes on the clock, starting now. Here we go. Medicare Advantage health plans may cut extra benefits in 2027. Wow. Who would have thunk that Medicare Advantage plans, like I said in the first edition of my book in 2019, I think, and it's still true today, even though it's in every edition of my book, when the government is paying the freight for your health insurance and the government decides to cut back on expenditures, who's gonna suffer? It's going to be the health plan that covers you if you were silly enough to purchase one of those health plans. And by silly enough, I mean Medicare Advantage plans are not the best choice for people. People still love the fact that they're free. They still think they're going to get all kinds of freebies and extras free of charge. But what happens when the government decides to economize? They start cutting back on those extras, those freebies, and those little gems that lured them into the Medicare Advantage plan in the first place. The problem is if you've been there for more than a year, your health better be good. Otherwise, you won't have an option of going to a Medicare plan with Medicare supplement, because Medicare supplement plans in most cases are allowed to underwrite. They're allowed to ask you about your state of health. And if it has declined, then it's very possible that you will not be able to improve your situation. You'll be stuck in a Medicare Advantage plan forever and ever and ever. Medicare Advantage health plans may cut extra benefits in 2027. So Americans enrolled in Medicare Advantage health plans should expect to see fewer extra benefits like gym memberships, vision and dental coverage next year. According to investors and industry experts. The U.S. government said earlier this month it would raise 2027 payments to insurance companies managing Medicare Advantage plans for people aged 65 and older or with disabilities by 2.48% on the average. Dr. Oz, head of the Centers for Medicare and Medicaid Services, has aimed to cut federal health plan spending. Insurance executives in recent weeks have said that those rates, while higher than first proposed, are not good enough. They don't want any rate that's going to cause them any sort of fiscal problems, apparently, but they're not in charge of things. When the government is in charge, you kind of dance to the government's tune. Added services, including coverage of vision, hearing, dental, and fitness programs, meals, transportation assistance, have helped entice half of the 70 million people on Medicare into managed care plans instead of the government's standard fee-for-service Medicare program. Cutting some benefits as well as exiting certain regions or states could shield Humana and its rivals, including United Healthcare and CVS, that's Aetna, from added cost. In other words, if they decide to leave certain areas that haven't been as profitable for them, it might remove some of the fiscal risk that they're going to suffer if the government's increase in their reimbursement rates is not high enough. Medicare Advantage plans account for 80%, 33%, and 12% of revenue 80% for Humana, 33% for Aetna, and 12% for United Healthcare. All insurers are likely to cut back on benefits, but Humana will be cutting back the most. Cutting those benefits encourages costly members with higher rates of medical needs to seek other plans. Aetna continues to offer quality insurance coverage in a manner that is sustainable for our clients and our business, said an Aetna spokesperson. United Healthcare declined to comment. Humana CEO Jim Richten on a Wednesday call with analysts and investors, said the company would have to make cuts to reach profit targets, but that it would try to retain what is most important to its members. We will adjust benefits to remain on track to deliver our 2028 commitments of returning to a sustainable margin of at least 3% profit. Now, 3% for a health insurance plan, that is unreasonably good. It's like grocery stores, very, very narrow profit margin with a grocery store. I think it's on the order of 3 to 5% in most cases, but I don't know. That's my speculation. Let's see. Bobby Hunter, United Healthcare's head of government programs, earlier this month said funding for its Medicare Advantage business is still below what it expects for 2027, but he did not mention benefit cuts. Spokesperson for AHIP, an insurance industry trade group, said as health plans incorporate recently released policies, they will continue to focus on keeping coverage and care as affordable as possible. So plan changes, voter backlash. Morningstar analyst Julie Utterback said that Humana has been offering more benefits in its 2026 plans than its rivals. Potential health changes in 2027 may just be a matter of leveling the playing field for Humana relative to its competitors. Medicare Advantage insurers often wait until June to announce changes to plans, she said. Based on United Health's recent comments, changes are not out of the question. So it's important to remember that those plans are not cast in concrete. They will change every year, and they're going to change in response to changing fiscal conditions. And if the fiscal conditions are not healthy, they're not going to be able to maintain the benefits that you have come to want, you Medicare Advantage customers. It's just one of those things. They're like the drug plans. The drug plans can change. I have some clients who failed to follow my advice and look at the ANOC, the annual notice of change letter that comes out every September. And the same is true of Medicare Advantage plans. When they send you that letter, you should open it and you should read it and you should try to understand it, because it may be a warning that your plan is going to change into something that you did not want to own and you would not have purchased. And that will start January 1st, typically. So the same is true of the Medicare Advantage plans as well as the drug plans. Here's a little article about a guy. He thought COBRA counted as coverage. Medicare said otherwise for life. A 64-year-old engineer takes a buyout from a 3,000-person employer in March. He signs up for 18 months of COBRA the same week, figuring he'll deal with Medicare when COBRA runs out. 11 months later, he turns 65 and walks into Social Security to enroll in Part B. The clerk pulls up his record, runs a quick calculation, tells him his late enrollment penalty will follow him for the rest of his life. He did not miss a deadline that he knew about. He missed a deadline he did not know existed. COBRA continues your plan, but it does not extend your Medicare window. Medicare's 8-month special enrollment period is the safety net that lets people delay Part B past age 65 without penalty while they're still working. That's not entirely true. The catch that most people never hear is the clock starts when the active employment coverage ends. Now, that's the important part, whether you're actively at work every day or not. When you're actively at work, that large company protection allows you to delay your Medicare enrollment. You don't have to enroll at all as long as you're covered by your large company. That's 20 or more employees, your large company health insurance plan. If you leave that company under COBRA, like this guy did, and you're over 65 at some point, the clock starts ticking. The government gives you 8 months to enroll in Medicare without incurring that lifetime late enrollment penalty. But if you go over the 8 months, then you're going to have a 10% late enrollment penalty for every year that you shined it on, so to speak. So that's a warning. COBRA does not count as active employment for the purpose of delaying your enrollment rules, your enrollment deadline. MEDIGAP rates are increasing and some plans are getting harder to qualify for. MEDIGAP is another word for Medicare supplement. They're continuing to rise while underwriting rules tighten, making early enrollment and yearly plan reviews even more important for long-time savings and coverage stability. That was the... I always take the pictures out when I copy these articles, and that was apparently the caption for a picture. Rising healthcare costs continue to ripple through retirement planning, and Medigap coverage now sits right in the middle of that storm. Many seniors noticed higher monthly premiums hitting their budgets while insurers quietly adjust approval rules behind the scenes. These changes do not just affect new applicants, they also reshape choices for people thinking about switching plans or upgrading coverage. Insurance companies respond to rising medical claims, longer lifespans, and higher hospital expenses by recalibrating risk. As a result, Medigap or Medicare supplement no longer feels like a simple set it and forget it purchase. I would disagree with that. There is one way in which it does feel that way, and this is me talking now, not the article. But if you were to take my advice and purchase high deductible plan G, or high value plan G, as Randy named it a long time ago, that is the best you can do at maintaining a modicum of stability in your Medicare supplement rates off into the future. That is the biggest tool that you can find purchasing Medicare supplement high deductible plan G. Why Medigap premiums keep climbing across the country? They continue to rise because insurers face steadily increasing healthcare costs. That's medical inflation, and that those costs directly impact claim payouts. Hospital stays now cost more than ever, and advanced treatments often come with staggering price tags that ripple through insurance pools. Many insurers also deal with aging policyholder groups, which increases the claim frequency and drives up overall risk. Inflation in medical services pushes pricing models higher every year. Stricter underwriting rules now shape who gets approved. Insurance companies continue tightening underwriting standards as they attempt to reduce financial risk across their Medicare supplement portfolios. Applicants who previously qualified easily may now face additional health questions, stricter evaluations, or even outright denials outside guaranteed issue periods. Chronic conditions such as diabetes, heart disease, or recent surgeries often trigger closer scrutiny from underwriters. Even seemingly minor medical histories can influence approval decisions depending on the insurer's internal guidelines. Well, nobody has to worry about any of this stuff if you enroll in your Medicare supplement when it's on time, either when you turn 65 or when you leave your job after having worked for a company with 20 or more employees. And if you didn't enroll in Medicare, you will have a guaranteed issue window to get your Medicare supplement at the same time that you enroll in Medicare. But the whole deal is you might want to qualify to pick up a cheaper Medicare supplement plan at some point in the future. And if you live in a state without a birthday rule, you won't have the option of doing that without being scrutinized by the underwriters at the new company that you want to purchase your plan from. That is the cost of delay, and taking the risk that your medical condition might not be as good as it was early on. So I have correspondence from people who are or want to become clients. In this case, Chris is checking in with a question. Chris is a client, but before he became a client, he said, I'm going to go with your recommendation, Doug. I'm curious why the costs are so much lower. Now, this is his drug plan, his prescription drug plan. If you remember when I was discussing my book, Prescription Medicare Drug Plans, a simple DIY guide, the book that's on sale at Amazon, I explained about the fact that there are all these plans available in any given location, and they go from cheap to expensive. And our job is to select the plan that's going to be the best for you, and that means the cheapest out of all of the available plans. So he says, I'm going to go with your recommendation, the highlighted one. I'm curious why the costs are so much lower than with the AARP plan. I don't always need to choose the cheapest plan on the list. The quality and dependability of the plan are important to me too. And I had to explain to him in a very diplomatic way that they all suck. All these plans are horrible to a certain extent, but the important thing is the plans are equivalent in that you want to have the plan cover your drugs where you want to have your prescriptions filled in your residential locale. The cheapest one that does that is going to be equally as, as quality is going to be there to the extent that you need it. And getting a more expensive plan does not provide any sort of a linear advantage. So here's the way I tried to explain it to him. I said, okay, the one you've chosen is the Humana Value Plan, and I've attached confirmation of the enrollment that I've just done on your behalf. When your drug and pharmacy lists were entered into the government website, the result was a list of every available drug plan available, and that they were listed in order of your out-of-pocket cost for the rest of the year. These were the three cheapest. The page that I sent him were the three cheapest in the total list of 12 available drug plans. So I said, imagine how many thousands of dollars plan number 12 would probably cost, because AARP that you thought was a reasonably expensive plan was just slightly higher than the one I'm suggesting you buy. So that was number 3 on the list. If you get all the way up to number 12, it's going to be hugely expensive for no appreciable benefit to you. Each plan has its own set of characteristics, like the drugs they cover, and we are comparing several variables for each enrollee: location, drug list, and preferred pharmacies. The best drug plan is always the cheapest drug plan that covers all of your drugs at the pharmacies you prefer to patronize. And then I went on to say there used to be over 30 plans available at each location, but the average is now around 10. This may not even exist for much longer. And I think all that was news to my new client. And while we're talking to new clients, this is Mark. He became a new client about the same time as Chris. And his question was, thank you for your prompt response and information. The cost difference, now we're back to Medicare supplement conversation here. The cost difference between Plan G and high deductible or high value Plan G is more than I expected. I am now strongly leaning towards the high deductible Plan G. It looks like just a couple of years or so of premium savings with the high deductible Plan G would essentially cover a subsequent high out-of-pocket year. I do have a couple of questions about the premiums for both Plan G and high deductible Plan G. His questions are, I expect the premiums to rise each year for both plans. Are those increases tied to my age so that I keep paying more and more based on just me getting older and more likely to use health insurance? Or are they tied to general inflation and or across the board increases by the insurance companies? And I answered that. I said the premium increases and sometimes their decreases are often based on many factors. Primary among them involve the company's loss experience, either overall or with a particular product in a particular area. With health insurance, they must maintain their profitability within a certain window. The government limits the amount of profit they are allowed to earn. Other factors I have witnessed include the corporate intention to increase or decrease sales, and reasons such as so arbitrary as rewarding or penalizing sales staff in certain areas. Your increasing age, hence increasing risk, and general medical inflation are important factors as well. So then the next question, is there any limit to how much premiums can increase each year, such as a Medicare or governmental rule or regulation? And my answer to that was Medicare supplements are regulated by the states, and each company must file their intention to raise rates and gain approval several months ahead of time. And the next question, finally, about how much have premiums for each plan increased over the past few years? An approximate percentage is fine. I just want to know generally what to expect. And I said, before general medical inflation grew in recent years, I would have expected 5% to 8% increases with Plan G and 3% to 5% for high deductible Plan G, with occasional deviations, including 0% or negative increases. The most recent regular increases I have witnessed were 25% for Plan G and 10% for high deductible Plan G. And then he said, with respect to prescription drug plans, I went through the website myself as outlined in your book, and I believe I have the lowest cost plan in my area picked out. Just to confirm, is that something I enroll in directly, or do I do that myself, or do you do that? And I said, feel free to do your own enrollment in the prescription drug plan of your choice. I will be happy to do it for you, whichever you prefer. And then I said, let me know about any other questions that come up, blah, blah, blah. And Mark and I are certainly happy with each other as he uses my services to hopefully save some money in the future. And now I've got the pièce de résistance. I told Randy that WalletHub redeemed itself to me, and I thought, oh my God, I've got to share this with Randy. It turned out to be a little more involved than I expected. I asked WalletHub what quizzes or what research it's done lately that it might have turned into interesting lists of the best and worst things. And this category is the best run cities in America. So, we really, there's so many cities here that we don't really have a good handle on all of them. But I will tell you that the best run cities in America, let me go through the first 5. Provo, Utah, Nampa, Idaho, Manchester, New Hampshire, Boise, Idaho, and Nashua, New Hampshire. Now, here's where WalletHub won me back over. This actually brought a tear to my eye. I'm going to go through the worst run cities in America, and you tell me if you recognize any of these cities. San Francisco, California.
Yes, I've heard of them.
Detroit, Michigan.
Yes, I've also heard of that.
New York City, Oakland, California, Chicago, Illinois, Philadelphia, Baltimore, Tacoma, Washington, Fresno, Long Beach. I couldn't have been happier to see this list. Tacoma, Washington. All the cities that are, they're being run into the ground basically by their inept political ruling class. Those guys are at the bottom of the WalletHub list.
I can't believe the WalletHub actually said that.
I know. It's like they're saying the things that they're not supposed to say out loud.
Did their funding sources all of a sudden dry up that caused them to rate them higher than one would imagine?
I have no idea what their internal problems are that cause them to actually tell the truth about some stuff that you and I have known they've always edged in the wrong direction of. But it's something went on to cause them to actually provide information that I think is pretty accurate and comports with what I know the real world to be, which is a change for them.
That is, I've got to tell you, Doug, that is shocking.
Yeah, absolutely. I knew you'd enjoy that. I knew you would enjoy hearing that.
Well, you know something?
What's that?
We're out of time.
I'm shocked to hear that. That is certainly, it only seems like 6 hours since we started this episode. I'm sure the audience is screaming for mercy at this point.
Are we done yet?
Please let us go.
All righty. Well, I'm going to go ahead and close up shop.
Please do.
If you approve with that, I'm going to go ahead and do it. So here we go. Grab your pencils, grab your pens, grab your marker, whatever you got. You need to write some stuff down, folks. DBJ at MLMmailbag.com. That's an email address that you can use to reach out to Doug any time of the day or night, and it might be critically important with you sometime. Licensed nationwide, he is. He can help you with your Medicare supplement planning in any state of the union. Again, I call him not we should call you Wallet Hub because you've got licenses that drop from your pocket all the way to the floor.
My wallet is a kind of tubby lately.
I
It's a
know.
little on the wide side.
Last time I saw it, it had wheels. But here we go. MedicareForTheLazyMan.com. That's where it's all happening on the web. I'm pretty happy with that website, and I think you would be too once you saw it. MedicareForTheLazyMan.com. Check out Amazon.com. We would appreciate some reviews on Doug's books. He does a really good job with that, and it really helps us out because we can stay ahead of the travel log people. And I know that sounds weird, but it's one of our goals in life to stay ahead of the travel log people. Subscribe to the podcast. That way you'll know when it's coming and when it's dropping. I think that would be handy. But last but certainly not least, thank you. You could have been anywhere else, doing anything else, with anybody else, but you weren't. You were with us listening to MedicareForTheLazyMan.com podcast. And I would like to say that nobody ever does it, but someday they will. You didn't keep track of the time. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. Now he's camped out in the low ground of Illinois. I know he's got more oxygen than he knows what to do with, so I'm going to let him go ahead and close up shop because he's got something to say. I know something something critically important because he's got so much oxygen, his face is red.
6.5 years of podcasting together, and I never run out of anything to say, as Randy well knows. So thank you for joining us, ladies and gentlemen. I'm so sorry to see you go, but I know that you'll be back for our next episode. So when that happens, we'll look forward to seeing you then. Bye-bye.